acromioclavicular joint. In this acromioclavicular joint, we'll see it is one special function is there. First, we'll see what is this acromioclavicular joint. It is a synovial joint. It is a synovial, plain synovial joint, and it is having the 3 degrees of freedom. That means 6 movements will be there. 6 movements will be there, and at the same time here, if you see, this is our scapula. This is our scapula. This is our clavicle. This is our clavicle. So acromioclavicular joint is going to see acromioclavicular joint is going to connect. Is going to connect the scapula. Connect the scapula to the clavicle. The acromioclavicular joint. This joint itself, it is going to connect the entire scapula to the clavicle, and at the same time, it is a synovial joint. So because of synovial joint, this acromioclavicular joint is having joint capsule. It will be having the joint capsule and disc. Sometimes disc may present, sometimes disc may not be present, may or may not disc, and ligaments. Okay, ligaments will be present for this joint to provide the stabilization. And one more last point, this acromioclavicular joint is going to maintain the relation between scapula and clavicle. So this is about the acromioclavicular joint introduction. If we see the articular surface of the acromioclavicular joint, so here first, this is the joint. Here the articular surface are different. The shapes will be very different from individual to individual. Now we'll see, it is the joint. It is going to form between the acromion process of the scapula, and at the same time here it is going to connect to the, this is first articular surface. Second one, lateral end of the clavicle. See here, if we take one scapula, so here I am drawing scapula. Here this is the posterior, okay, this is the acromion process, glenoid cavity. This will be like this. So this is the spine of the scapula. This is the acromion process of the scapula. This is the glenoid cavity of the scapula. This is posterior view. Suppose if we see anterior view, glenoid cavity, this glenoid cavity will be here. This is the medial border, lateral border. So here we will be having coracoid process. Anteriorly we can see coracoid process, and this is our scapula. The spine which is coming posteriorly, it will be like this. The spine will be like this. So this is the acromion process. This is the coracoid process. So it is going to form between the acromion process of the scapula. See here, this is acromion process. Here this is acromion process of the scapula and the lateral end of the clavicle. And one special point about this one, the congruency. Okay, the congruency of the articular surface are little different. Mean the congruency is very different in this acromioclavicular joint. If we see, suppose this is our acromion process, and this is our clavicle. Acromion and clavicle. Some of the individuals will be having like this. Articular facets, and some individuals, see, it is a little like this direction. It is in this direction. If we see some other individuals, acromion process will be straight and clavicle also will be like straight. This is clavicle acromion. This is one variety. Second variety, here it will be like this. And if you see third variety here, acromion process will be like this, and clavicle will be like this, clavicle and acromion. Here also the variation in the shapes of the articular surfaces, And one more, if you see fourth variety, here acromion process will be like this, and clavicle will be like this, clavicle, this acromion. So the connection between acromion and clavicle, the congruence of the articular surface is less, and at the same time the shapes, it may vary from individual to individual. And at the same time, suppose if you take one person here, right side and left side, the right side is different from left side sometimes. Okay, sometimes left is different from right side, sometimes both are same. It is very different. So that's why this is the reason here the arthrokinematics. If you see arthrokinematics are little difficult. We can't even predict exactly what kind of arthrokinematics are happening inside the articular surfaces. That's why it is little difficult here, arthrokinematics. So this is about the articular surface of the acromial joint. If we see the disc of the acromioclavicular joint, it is also same like articular surface only. This is little different. Suppose this is our acromion process, this is our clavicle, this is acromion. So here the points what we are seeing here, acromion and clavicle, this space we are seeing here, between these two articular surface will be having articular disc. Sometimes there is no articular disc, so it may present or may not present in the individuals. Sometimes if you take one person, if you take, the disc will be present. It is going to change the shape and size from first day of life to further decades. That means when the person is in 2 years, the disc will be in one shape. Okay, when the person is in 10 years, the disc will change. If he is in 25 years, then the disc will change again. At the same time, right side to left side. Suppose if right side disc is there, maybe left side it won't be there. If like sometimes both side disc may present. It's like it's like that we can't even predict how it will be. It's completely depends upon the genetics. So this is about the disc. What is the use of this disc? What is the use of disc means already we discussed in so many joints. If the articular surfaces are incongruency means one articular surface will be big, otherwise one articular surface will be small. So to increase the articulation between those two articular surface, we need extra assistance. That assistance is provided by the disc in the synovial joint. So this is about the acromioclavicular joint disc.